Hi, so my question was, why do serial killers kill and what can be done to prevent it from occurring at all? Because there's a significant issue with serial killers, but it all ultimately comes down to why do these people kill and what can be done to prevent these types of killings from happening in the future. Um, there are reasons such as environmental, developmental, and biological factors. And after a bunch of research, I came to the conclusion that we need to change how we approach mental health and focus on rehabilitation of violent offenders rather than punishment. um, Things we can look at are early childhood development and looking into possible roots from there, looking at biological factors to recognize risk factors, psychological factors, and mental illness to start medication, and looking at the motives of past serial killers and typologies can help us have a better understanding to prevent such violent crimes in the future. When these risk factors start playing out, families and psychiatrists need to take them more seriously and look deeper into the individual. Um, there's many early childhood developmental factors that can lead up to someone ultimately becoming a serial killer. Um, Therapy can be an early intervention to heal from roots of their childhood. One early childhood developmental factor is experiencing abuse as a child. Almost every interview with a serial killer revealed that they had experienced some type of abuse or neglect as a child. When experiencing neglect, the child lacks idolization from their caregiver that's needed while growing up. For instance, like a mom's face lighting up when a child starts taking their first steps. That doesn't happen for them when they're being neglected, and this has an effect on their sense of self. Um, Being neglected also leads to obviously isolation and loneliness, which leads to an inability to form relationships and attachment to others. Another form of abuse is violent sexual events. This creates a loss of control, which they gain their power back through killing people because they have victims rather than being the victim. Another one, obviously, is physical abuse. Certain areas of the brain can be damaged from physical abuse that really has an impact on them. The temporal lobe really has to do with emotion and aggression. The frontal cortex, the damage to that has a big impact on an individual's judgment. Not only being involved in physical abuse, but watching physical abuse or mental abuse, or being degraded by a parent makes it difficult for them to have empathy for others. And looking at the root of the issue in therapy for someone who is acting violent is important rather than just trying to come up with coping for the violence itself. Another thing is biological factors. They've looked at brain scans and there's been chromosomal abnormalities. This can especially occur in men during puberty. Another thing is DNA and genes. Certain genes can affect how brain cells communicate by regulating movement of calcium into and out of cells, and calcium is a very influential factor on brain cell function and mental health. Environmental influences can trigger these. Just because someone has these biological factors, it doesn't necessarily mean they'll become a serial killer, but they're more prone to psychopathic tendencies being turned on depending on how they're raised. Brain function also depends a lot on structure. It was shown that the brains of people prone to violence had looked very differently and had different brain activity and genetic makeups of the brain compared to normal people. There is also neurodevelopmental disorders, and if the orbital cortex or its communication pathways are damaged, um, that has things to do with it. Things that can also affect the brain and its structure can be drug use, injury, or a stroke, and that can completely change the brain structure. And the amygdala is free to promote its rather primitive agenda of animal-like passions, which includes aggression, violence, and rage. And that would explain why serial killers don't have correct judgment and film or raging go on killing sprees. The only treatment in this case would be medication to prevent it from happening, to try and control that abnormality and chemical makeup in their brains. And if kids are already displaying symptoms such as like being aggressive towards animals or anything like that, then they could take a look at their brain scan. And, that looking at that brain scan, you could use that to indicate further interventions that can potentially decrease the number of murders from occurring at all. Psychological factors. One of the biggest things is depression, because that means low self-esteem, and that can lead to the need to feel a sense of control. And they'll gain that back through killing and messing with police, like some people call into police departments to try and gain control of the situation. And there's also a way that we can look at psychopathic symptoms that can be used with Hare's psychopathy scale. This scale measures the highest when people have a low response to a fearful image because their brains do not process things the same way as someone with a normal brain. This scale can be used if someone starts exhibiting early symptoms such as no empathy for others. Another thing to look at is the motivations and typologies, because this can obviously help us have an understanding of how these early indicators in life can create a motivation. One of which is a visionary killer. These people are psychopathic and kill due to their hallucinations or obeying voices in their head. Medicine and therapy are important if the child starts experiencing psychopathic symptoms like hearing or seeing things, although sometimes it's difficult money-wise for people to get that type of help that they need, so we need to make sure that people have access to healthcare, especially if they're having these symptoms. Another one is a mission type. They believe it's their mission to get rid of certain groups or people in the world. This may have to do with how they're raised by their parents as far as being prejudiced. It would be useful to do therapy that helps with them having less hatred for a particular group of people. There's hedonistic serial killers. This includes lust killers who are motivated by receiving pleasure from the killings, and thrill killers who are motivated by excitement and thrill that they experience when killing. And then there's power killing type. They have dominance over victims, so they feel power back over their life. This is common in people who experience what I talked about earlier in childhood development. Looking at these motivations and typologies of past serial killers can explain what these developmental issues can turn into if left untreated. It shows why it's important to get help if there are risk factors. Overall, there's a lot that violence roots from. Therapists and psychiatrists need to look deeper into where this violence may be rooting from rather than just trying to stop them from acting on violent impulses. Prisons could also do their part by really focusing on rehabilitating someone who has hurt someone else before releasing them back into the world. Although there are many things that can be risk factors, it would be useful during early intervention for doctors and psychiatrists to perform tests if someone starts displaying early red signs.